with the Professor Ahmed Tageldien, South Carolina University. When thyroid talks, heart must be listened.
بسم الله الرحمن الرحيم. طبعا يعني انا ما اعرفش بس هل انا الوحيد اللي كارديولوجيست في القعده دي ولا لا؟ But anyway, I'm very happy to be here in thyroid Egypt. وبشكر Professor غادة الخطيب and all the chair boards and chairpersons for being here. My talk today is about thyroid and heart. When thyroid speaks, heart should listen. عارفين مين ده؟ طب عارفين مين دي؟ طيب الاولاني هنجيله في الاخر. طبعا دكتوره غاده انا اوريدي شكرتها. Thyroid disease and heart thyroid hormones have an intimate relationship with cardiac function. The most significant signs and symptoms of thyroid disorder actually cardiovascular manifestations زيها زي الدايابيتس. common manifestations of diabetes cardiovascular disease will first cause of death and mortality and morbidity in diabetes as well as cardiovascular disease. ما نروحناش بعيد. Evidence has revealed that contribution of thyroid hormones to cardiovascular events exerting their action through genomic and non-genomic pathways within the cardiac myocytes. طبعا cardiovascular system is adversely impacted by any fluctuations in the thyroid hormones up or down. With thyroid dysfunction has direct relationship with myocardial contractility, systolic and diastolic blood pressure, systolic and diastolic heart failure as well. طبعا يعني مش هنبيع الميه في حاره السقايين. This is how TSH abnormalities are diagnosed in general population, where the effect of thyroid hormones on cardiac myocytes is not a theory of the thyroid hormone increase contractility or increase heart rate. No. Thyroid hormone has direct relationship with the functioning genes working on cardiac myocytes, either by upregulation or downregulation, and that's very important. So we can see that there are what's called T3 regulated cardiac genes. طبعا there is no time to explain all these genes. However, it's related mainly to cardiac contractility and elasticity, which is very important actually for the cardiac function. So thyroid hormones can affect liver, pituitary gland, the cardiovascular system, and all other systems, as you all know. And this is how thyroid hormone affect the cardiovascular system. It increases when thyroid hormone increase. Actually, it increases the heart rate, the stroke volume, cardiac contractility, systolic blood pressure, diastolic blood pressure. And when thyroid hormones are depressed, they downregulate important genes for the myocardial contractility and elasticity, which leads to either two phenotypes of heart failure in thyroid disease. We have heart failure with preserved ejection fraction. You might find this in diastolic heart failure in hypothyroidism, and on the other hand, we have high cardiac output failure, then systolic heart failure in patients with hyperthyroidism, which cause tachycardiomyopathy. These are the important parameters of the cardiovascular system in hyperthyroidism and hypothyroidism. They are all affected, actually. And if we go to the effect of thyroid hormones on arrhythmia, hypothyroidism leads to different types of bradycardia, of AV block, and sometimes high-grade AV block, while hyperthyroidism leads to different types of tachyarrhythmia, including from the simplest form, which is sinus tachycardia, up to BVCs and VT in eligible patients who have some electrolyte abnormalities. So the effect of hypothyroidism on cardiac myocytes and peripheral circulation is illustrated here. And just to sum up this point, that in hypothyroidism, T3 and T3 is reduced as well as T4, and this affects the upregulation of important genes controlling the contractility and the regeneration of the cardiac myocytes, and this leads actually to some sort of impaired elasticity of the cardiac myocytes, bradycardia, first degree heart block, and this might lead to progression of heart failure, especially heart failure with preserved ejection fraction. Hypothyroidism and cardiovascular disease, there is a direct relationship of the level of T3 and cardiovascular mortality and morbidity regardless of the manifestations of hypothyroidism. And this is in the general population and especially in the geriatric population as well, what's called the subclinical hypothyroidism syndrome. Any patients with heart failure in outpatient clinic of cardiology, he should or she should be assessed for T3 and T4 to screen for hypo or hyperthyroidism. So hypothyroidism and cardiovascular disease, many factors. The most important ones are the bradycardias and the impaired elasticity and myocardial contractility. So the low T3 syndrome actually affects the heart in different ways. One of them is ischemia and the other one is heart failure. And usually this is associated with dyslipidemia because hypothyroidism is associated with dyslipidemia, especially with hypertriglyceridemia, which is very deleterious to the cardiovascular function. Of course, we will not go through this, but all these important studies revealed that management of hypothyroidism in heart failure patients or in ischemic heart disease improves cardiac contractility and improves the outcome of coronary artery disease. And this is how hypothyroidism and subclinical hypothyroidism might affect the cardiac function. Now, if you go to the other hand, which is hyperthyroidism, increased levels of free T3 and free T4, actually they affect the heart rate, increase the heart rate, and leads to different types of tachyarrhythmias, including the simplest one, which is sinus tachycardia up to atrial fibrillation, and sometimes ventricular BVCs and ventricular tachycardia. This will lead to reduced cardiac output and will lead to some sort of heart failure with reduced ejection fraction. So hyperthyroidism and cardiovascular disease, again, it's highly associated with hypertension, with heart failure, with preserved ejection fraction initially, but at the later stage, this will lead to what's called tachycardiomyopathy, which lead to dilated LV and low ejection fraction. And we have some series from Hull University in the United Kingdom about reversible cardiomyopathies. And one of these reversible cardiomyopathies is hyperthyroidism. So if we go, if you go to the hyperthyroidism and cardiovascular disease, it affects the peripheral vascular resistance. It leads to elevated systolic and diastolic blood pressure, elevated heart rate, tachycardiomyopathy, stimulation of RAS system, which all lead to deleterious effect of heart failure with preserved, then with reduced ejection fraction. So this is hypothyroidism and some sort of diagram illustrating the effect of hyperthyroidism in the cardiac output and the cardiac function. So there are some important guidelines from our side in the cardiology point of view that in all patients with heart failure, in all patients with atrial arrhythmia, you should screen for low T3 or high T3 or low T4 or high T4. You should exclude hyperthyroidism or hypothyroidism in different types of bradyarrhythmias, tachyarrhythmias, heart failure with preserved ejection fraction or with reduced ejection fraction. So my take-home message, this surah al-awwalaniyya, and this is Caleb Perry, the godfather of cardiovascular endocrinology. And at 1786, Mr. Caleb Heller Perry described a woman with goiter and palpitations whose each systolic shock the whole thorax. غالبا كان عندها تاكيكارديا بسبب الهايبرثايروديزم، ومن هنا نشأت فكرة الكارديوفاسكولار اندوكراينولوجي. الدياجرام ده معلوش علاقة بالثايرويد قوي، لكن ليه علاقة بالميديكال اديوكيشن وبالميديكال نوليدج وبالميديكال اديوكيشن، وده احنا اتعلمناه يمكن from year 1 Faculty of Medicine South Carolina University that there are some types. أنا بس عايز أشاور usually some knowledge is must to know، لازم تبقى عارف بعض النوليدج، بعضها nice to know and بعضها nice to have some idea about. كل ما بنكبر في السن كل ما تقريبا كل الدايرة دي بتبقى blue. You have to know everything about what you are doing. As regarding الكارديوفاسكولار endocrinology، يمكن أنا حابب أشير إلى أن Egyptian Society of Metabolic Syndrome actually is a collaborative work between endocrinologist, cardiologist, internist, and nephrologist, which is the whole participation of the cardiovascular endocrinology. So when thyroid speaks, heart should listen. Thyroid hormone dysfunction can have devastating impacts on the heart, such as arrhythmias and or systolic and diastolic heart failure. Hypothyroidism has a different effect on the heart, and treatment with levothyroxine have been shown to improve this dysfunction. وزي ما قلت لحضراتكم ان level of T3 especially low T3 مع كل 0.1 change سواء بقى مايكروجرام او بيكوجرام على حسب اليونت اللي بيتقاس بيها حسب الاسسمنت, there is a change in the cardiovascular mortality and morbidity. However, treatment of subclinical hypothyroidism has been controversial and has mixed results. However, this should be under control of endocrinologists, of course, in association or collaboration with cardiologists. Aging population has to be screened for thyroid dysfunction. That's very important. أي عيان aging جاي يشتكي لك في العيادة بأي حاجة حتى not related to the cardiovascular system, you have to check for the thyroid because it affects many systems, not only cardiovascular, but the liver, the gut, the mentality, the cognitive function, and so on. And of course, presence of heart failure, bradycardia, tachycardia, hypertension, hypotension should be screened as well for thyroid functions. So this is the simplified diagram. Illustrating the thyroid gland hypofunction and hyperfunction and how they could affect the cardiac function. So we'll see that in hypothyroidism, you will have impaired cardiac contractility, impaired diastolic function, increased vascular resistance, and the most importantly, different types of bradyarrhythmia, starting with sinus bradycardia, first degree heart block, and then high grade AV block. While in hyperthyroidism, you will have palpitations, atrial fibrillation, sinus tachycardia, BVCs, congestive heart failure, and systolic hypertension. For those who likes more sophisticated diagrams, you can see clearly that thyroid affects cardiovascular system through genomic and non-genomic actions. Thyroid hormones affect upregulation, downregulation of many genes affecting the cardiac contractility and cardiac regeneration and cardiac function as well. So genomic and non-genomic actions, and those non-genomic includes increase in heart rate in case of hyperthyroidism, increased systolic, diastolic blood pressure, or in cases of hypothyroidism, decreased cardiac elasticity and presence of heart failure with preserved ejection fraction. And this is the manifestations of hyperthyroidism and hypothyroidism. Thank you very much. شكرا جزيلا لكم.